Welcome to the Healing Pain Podcast with Dr. Joe Tatta. Each week, we interview top experts in physical therapy, pain science, and integrative pain care. You'll learn the most up-to-date information for treating and reversing persistent pain. This podcast is for educational purposes only and not intended to be used as personalized medical advice. And now, here's your host, Dr. Joe Tatta.
Hey there, friends. Welcome to this week's episode of the Healing Pain Podcast. On today's episode, we're discussing how to treat individuals with osteoarthritis, as well as how to promote public health campaigns for effective treatment. My expert guest this week is Kirsten Ambrose. Kirsten is the Associate Director for the Osteoarthritis Action Alliance at the University of North Carolina. She has a Master's of Science and more than 20 years of experience managing multidisciplinary teams towards successful research conduct in chronic pain-related disorders and public health action for osteoarthritis awareness. Her experience includes delivery of physical activity education and programming to individuals with various chronic pain conditions and disabilities. On today's episode, you'll learn all about osteoarthritis, what you can do to manage or prevent osteoarthritis, and how you can engage in effective public health campaigns for the treatment of osteoarthritis. Okay, without further ado, let's begin and let's learn all about the care of osteoarthritis with Kirsten Ambrose. Hi, Kirsten. Welcome to the Healing Pain Podcast. Thanks for joining me.
Thanks for having me, Joe. I'm excited to be here.
We're going to talk a lot about osteoarthritis today, both some of the kind of intervention-based treatments, as well as some of the probably epidemiology behind it and why it's important for licensed health professionals, as well as for others to start to, turn their attention toward it. You do lots of great work at the Osteoarthritis Action Alliance, which we'll talk about. But give us a little bit of background on who you are and your career and how it's led you up to this point.
Mm-hmm. Sure. So my background is in exercise physiology from an academic standpoint. And perhaps like many people, I didn't really know what I was going to do with that once I graduated. I didn't have a big plan. And I found myself in a research group for fibromyalgia, actually studying chronic pain syndromes, idiopathic chronic pain syndromes, that whole spectrum of conditions, fibromyalgia, temporomandibular disorder, the whole nine yards. And I was in that for about 15 years and had a lot of really wonderful experiences. But like much with research, given that I was not the researcher, I was as a clinical study coordinator. So my path kind of hit a wall at some point, and I needed to decide where I was going to go next. And really decided that I wanted to take a little bit of a different tack from research. And my very good friend, Lee Callahan, who is the director of the OA Action Alliance, she's an epidemiologist studying a lot of physical activity related to arthritis and just population research in arthritis. And she had a position opening up at the OA Action Alliance. And in fact, the CDC the CDC and the Arthritis Foundation in combination started the OA Action Alliance back in around 2010 or 2011. And it was with the Arthritis Foundation for many years, and they had a whole shift in their programming. So CDC brought it to UNC Chapel Hill, where Lee was. Lee has a long history with CDC. So she needed somebody to run the show with her. So she knew I was looking, and there we ended up together.
Excellent. So of course you mentioned it's at University of North Carolina, Chapel Hill. It's called the Osteoarthritis Alliance, Action Alliance. Everyone can Google it, and we'll give you the link later on, of course. But tell us briefly, what is the aim of the Alliance and what are the typical members who are involved in it like?
So we are a national coalition committed to elevating osteoarthritis as a priority in policy, both environmental and systems policy solutions to reduce the toll of OA. We were sort of born out of the National Public Health Agenda for Osteoarthritis that originated in 2010. We just updated it for 2020, and it serves as a blueprint for the nation, but it is for us to operationalize through the Action Alliance to guide the nation with strategies from a public health perspective to address OA. And those strategies include things like proven public health interventions around physical activity, weight management, injury prevention, self-management education, as well as strategies to promote delivery of evidence-based programs that help with those interventions. strategies to promote alliances with different organizations or different entities, like, say, insurers and healthcare systems, or what, to promote better care for OA, better coverage for OA. We also have a strategy for addressing health disparities and improving health equity for musculoskeletal conditions, which I think we're kind of primed for in this country. And then finally, for research, both surveillance, that is really what a lot of the CDC does, looking at the broader population, prevalence rates, incidence of arthritis in the country, as well as those organizations that fund research, like NIAMS, the National Institute of Arthritis, Musculoskeletal, and Skin Diseases at NIH. As a coalition, we are mostly comprised of organizations across a broad swath of sectors. We want people at our table, from healthcare to the media to businesses to community organizations. Osteoarthritis does not discriminate, so we want to make sure that our public health actions are speaking to everyone. And so we want all of those people at our table to help guide what we do. We do also have a couple of individual stakeholders, whether those are healthcare providers or patients, people who have OA, or youth athletes even, or coaches, to really get into the weeds with us and guide our content development and make sure it resonates with them, so that we're putting stuff out there that's useful and not just going to sit on a shelf.
Excellent. Very good. So a broader public health approach to osteoarthritis. And you mentioned stakeholders and other healthcare practitioners. What role do physical therapists play within the Action Alliance, and contributing, obviously, to the AIM?
Mm-hmm. Absolutely. In fact, the American Physical Therapy Association is one of our members. We know that they are also very strong proponents of evidence-based programs for arthritis, and are certainly, we consider, and I believe they would consider themselves too, physical therapists, as primary care providers on the spectrum of primary care. So they are seeing people who have OA front and center, treating them in a clinical care setting, as well as trying to facilitate outpatient care once their physical therapy sessions are over, or even during, but while they're at home. So we work very closely with physical therapists regarding OA across the spectrum, from athletes who are recovering from injuries in a rehab setting, to older adults who are either post-joint replacement surgery or just struggling with the mobility issues and things that come along with osteoarthritis.
Excellent. I'm encouraging more and more physical therapists to get involved in public health initiatives with regard to many chronic diseases, osteoarthritis being one of them. Mm-hmm. Speaking of osteoarthritis, tell us from your perspective, what is osteoarthritis, and how does that differ from the common rheumatoid arthritis that we often hear about?
Mm-hmm. Yeah, I think we get a lot of questions about the differences because people don't know unless you've been diagnosed. And people perhaps more often would be diagnosed with rheumatoid arthritis because of the nature of that illness. And I'll start there. Rheumatoid, just as a distinction, is a systemic autoimmune disease. So while it does affect the joints, certainly there's joint pain that's characteristic, joint stiffness, those types of things. Rheumatoid gets much further beyond and also affects other systems. There's more of an inflammatory component to rheumatoid arthritis. It's just a whole different type of disease. There is a little bit of overlap in the treatments, and I'll get into a little bit more about this with OA, but physical activity and managing a healthy weight certainly work very well for rheumatoid arthritis. Osteoarthritis, on the other hand, is a disease of the joint itself. It is really localized to the joint that's affected. So whether it's the knees or the hips or even the fingers or shoulders, it is very localized. There is an inflammatory component to osteoarthritis, but again, right there in the joint itself. And it's kind of characterized by cartilage that breaks and wears away over time. I want to pause there for 1 second and just correct that osteoarthritis is very often considered a disease of wear and tear. As we get older, it's inevitable. We try to get away from that description at the OA Action Alliance and even at the Thurston Arthritis Research Center. We know that it's far more complex of a disease process than simple wear and tear. Not everybody gets it. It's not inevitable. So it's definitely more going on. Cartilage does break and wear away, so that nice cushion that's in a healthy joint is no longer there between the bones. The synovial fluid that's also in a joint capsule can become inflamed or just increase in amount to make up for some of that cushioning. The ligaments around a joint can become lax and less supportive of that entire joint space. And also the muscles, for example, the quadricep muscle for a knee that's affected by osteoarthritis weakens and is not supportive, and you really start to see problems with mobility and that sort of thing. So alignment, also structural alignment, whether somebody colloquially is knock-kneed or bow-legged, that can put a lot of strain on the joints over time. The main symptom for OA really are joint pain. That's the biggest one, followed by stiffness. Sometimes stiffness will go away in the morning if somebody gets up and feels very stiff, but once they start to move, that can go away. Loss of range of motion, mobility issues are very common for OA, joint swelling, cracking, clicking, crepitus in the joint space. All of that contributes to OA, but it is very local to the joints that are affected.
Excellent. Really nice overview. And I'm glad you spent some time just talking about how osteoarthritis is not a wear and tear condition. That's kind of a very old way to look at the disease process or the condition. There are many people who are in their advanced ages of life who also have some osteoarthritis in their knee that live very full, active lives and actually have zero pain at all. So it's really good that that's part of the Alliance's perspective with regard to the care and management of osteoarthritis.
Absolutely.
As we're talking about the care and management of osteoarthritis, talk to us about some of the key points with regard to prevention for OA.
So I think this kind of went along with the wear and tear that people thought it was inevitable. I mentioned earlier in the podcast, OA can be prevented. Probably the biggest things that work to prevent OA are managing a healthy weight throughout life, or if somebody has obesity or is overweight, losing weight will go a long way towards preventing the eventual development of OA. And injury prevention is very big as well. Somebody who is either an athlete, even in high school, if you tear your ACL or rupture your tear a meniscus, something like that, that can also set you on a path towards the development. Again, not inevitable that somebody will get OA, but those are two very distinct areas that increase your risk. So we know we can prevent both if we can prevent injuries, either athletic injuries or from a fall. Falls prevention is also a big thing that we talk about, and obesity, managing weight.
And along with that, managing weight. So physical activity is part of that. Is nutrition a part of the self-management of the prevention as well as treatment of osteoarthritis?
Definitely. And actually there's, I mentioned my colleague, Lee Callahan. She is participating as an investigator in a study that's out of Wake Forest. It's sort of a collaborative study across the state of North Carolina, really, that is looking at exercise and nutrition for managing osteoarthritis. And in fact, this is a community trial that's happening now that builds upon a more rigorous laboratory type study that already indicated that people who participated in both a diet and exercise group, as well as a diet group, had better outcomes for their osteoarthritis in terms of both losing weight and some inflammatory markers. Exercise is beneficial, and maybe we'll talk about that in a minute, but certainly nutrition and diet are extremely important.
Yeah, I know that study. I believe it's a meta-analysis or a systematic review I think you're referring to. Is that right? They could have participated in a meta-analysis, but the one I'm talking about is euphemistically called the IDEA trial. Yeah, IDEA trial, yeah.
Yeah. So a big trial in the state of North Carolina, and now they're taking that rigorous trial to a pragmatic community-based trial, 18 months of treatment, whether it's diet and exercise, just diet, just exercise, to see what we can do practically outside of the laboratory.
Yeah, that's great. I love the multimodal approach to treating this condition. That it's in that study, and it sounds like that evidence-based work has been carried over into the Osteoarthritis Action Alliance.
It is, and actually that's one of the functions that we serve, is to be that public health voice for the researchers. And in fact, the Osteoarthritis Research Society International is a close partner of ours, and they are obviously by name very heavily focused on research, and they They are a professional organization of researchers, and we provide that public health voice to take what they put out from a research perspective in the lab, the ivory tower kind of science that's vital to what we do, and gives us the credibility and the evidence that we need to put out the information, whether it's educational awareness messaging, developing new tools and resources. So it's really sort of a symbiotic relationship there.
In that idea study, I don't know, I don't remember all the details per se. Maybe you remember some of the details, but I believe the outcome was that people who were engaged in nutritional intervention as well as physical activity had better outcomes, but also changed inflammatory markers, which I think was really important in that study.
Mm-hmm. That is true. And I think the impact was greatest in those groups that had the dietary component compared to only exercise. IL-6, I believe, was the inflammatory marker that was highlighted the most, and that was reduced in that study, as well as just what sort of the fallout of the weight loss aspect of it is fewer compressive forces on the joint. So joint loading was reduced. And a lot of the work that Dr. Messier has done out of Wake Forest has sort of built upon this whole idea. In one of his very early studies several years ago, they found this sort of nugget that everybody takes away that I think is really important, is that for every 1 pound of weight loss, that translated into about a 4-fold decrease in compressive forces or the sense of loading on a joint. So translated, if we say, if you lose 10 pounds, that translates to about 40 pounds of loss that you feel on your joints. That's significant. Yeah. And for most people, 10 pounds is a reasonable amount of weight to lose. Any amount of weight is challenging. Obesity is so complex as a disease itself. But it really matters. A little bit goes a long way in terms of weight loss and reduction in inflammation.
Yeah. And you mentioned obesity, which is a chronic non-communicable disease, gets a lot of attention. Why is it that osteoarthritis does not receive the same attention?
That's a good question. And it's actually one of the sort of casual reasons why we exist. We want to bring osteoarthritis up into the conversation. We know that when we talk about obesity, that 1/3 of people who are overweight or have obesity also have arthritis. If we look at other chronic comorbid conditions, cardiovascular disease and diabetes, 50%, almost 50% of the people who have those conditions also have arthritis. So a lot of these conditions travel together. People who have OA are extremely likely to have upwards of 3 to 5 additional chronic conditions. Where this matters is that the treatment strategy for physical activity and weight management overlaps with all of these chronic conditions. But I think what gets forgotten is that joint pain can be a barrier to physical activity. Mm. And if that's not getting discussed in a clinical care setting, if the doctor's not asking the patient, if the patient's not volunteering that joint pain is a problem, then no physical activity will happen, and then we don't help our hearts, we don't help our blood sugar. So they're all intertwined, and we need to make sure that people understand how they're linked.
Excellent. So we hear that physical activity, we know that physical activity is beneficial for promoting health and for promoting healthy lifestyles for those living with osteoarthritis. Sometimes people are scared to exercise because they don't want to injure themselves. They don't want to potentially cause what they would identify as more damage. What do you say to people who are fearful of moving their body, exercising, being more physically active when they're living with osteoarthritis?
It's a common question that we get, or a common concern that we hear, and it's understandable. Whenever you are physically active, you might actually experience a little bit more joint pain. Nobody wants more pain, and certainly don't want to make your disease process worse. We know that physical activity may not prevent osteoarthritis. There isn't any convincing data that says that it will prevent osteoarthritis. But once you have it, there's also not convincing evidence that physical activity will make your arthritis worse. In fact, the opposite is true, that physical activity actually helps with the disease. It helps your symptom management. So what you're doing is keeping your joints mobile, keeping the range of motion as full as you possibly can, reducing stiffness. You're basically countering all of those symptoms I described in the beginning. keeping your muscles and the ligaments strong to support the joint that's affected. Helping to reduce some of the inflammation. We talked a minute ago about the IDEA trial, and we know that diet's a big part of that. But exercise in general for anybody has effects on reducing inflammatory markers. So it's very important that way. Exercise will help people by maintaining strength. You also help to maintain balance, improve agility, which will help prevent falls. There's so much that gets tied up with exercise, and probably the biggest advice to give somebody who hasn't exercised either ever or in a very long time is just to start low and go slow. Nobody is talking about running a 5K or joining the gym, or it much like weight loss. A small amount of weight loss can have a significant impact on joint pain. Small amounts of physical activity can have a significant impact on both your just overall health as well as improving joint pain symptoms. So short amount of time, light amount of weight. Walking is easy. Theoretically, everybody knows how to walk, and it takes very little equipment. It doesn't take much, but it will go a long way.
Yeah. And you mentioned kind of overall health. One of the things we know is as you move, you start to improve your mood, or your mood becomes elevated the more you move. So there's an aspect of an elevated mood that is accompanied by physical activity that has an impact on osteoarthritis as well, right?
Absolutely. I mean, on the opposite side, people who have chronic pain often have depression and anxiety and feel stress and, over the inability to complete their daily activities or to work or all of that. Sleep can be affected by pain, any pain condition, including osteoarthritis. So you're right, physical activity has that counterbalancing effect of boosting mood and helping to improve sleep and improving overall health and fitness and overall disease risk profiles for all of the other conditions too that could be exacerbating OA.
People are often concerned about joint replacements. They see that as an option, a potential option. Some people see it as if they've been diagnosed with some type of OA, they see it as the only option for them. What is the Alliance's perspective on joint replacements with regard to osteoarthritis?
We would argue that is the last option. It should be sort of the end stage disease option when you have exhausted all other options or your disease condition has progressed to that point. Unfortunately, we have no drugs, unlike rheumatoid arthritis I described in the beginning, to change the disease process for OA. So all of the current treatments, whether we're talking about the non-pharmacological, physical activity, weight management, self-management, education, disease education, or NSAIDs, joint injections, all of those work to a point to manage symptoms. At some point, though, perhaps somebody gets far enough along the path that they simply they have no other option. That's a discussion to have with a doctor. At the OA Action Alliance, what we promote are those behavioral interventions, the physical activity, weight management, injury prevention, self-management, education, and other sort of non-pharmacologic therapies as the first line of defense. And in fact, the American College of Rheumatology also includes in their guidelines for the treatment of hand, hip, and knee OA that they just updated in 2019, they strongly recommend physical activity and weight management as the non-pharmacologic therapies. So that's really what we promote as well. We know that people may go on to a joint replacement, but also keeping in mind that joint replacement is extremely invasive. Mm-hmm. It's very common now, and I think perhaps patients get a false sense that it's nothing, it's outpatient or one overnight, and my friends have had it, and it might be the thing for me. What's the big deal? It's extremely invasive, and it is not for everyone. And in some patients, it's not even better than physical therapy. So it really is a consideration for you and your doctor if you're the one thinking about it. It's not to be taken lightly.
Yeah, very well said. I mean, with the amount of comorbidities that often exist with osteoarthritis, electing for a surgery like that has significant risk for it. It doesn't always come out, rosy the way we see it on, pamphlets and things like that. It's a significant surgery that requires, there's some risk involved in it. There's potential side effects, and there's, for some people, a longer rehabilitation period, depending on what their health is like going into the surgery. So, yes, we look at this as a last option for people with osteoarthritis. I know the opioid epidemic has probably had an impact on the Alliance, and now we have a COVID pandemic, so to speak, and a COVID epidemic here in the United States. How has that impacted what the work you're doing at the Alliance and the public health outreach and initiatives that you're all working on?
The opioid epidemic or the COVID epidemic, or both?
Well, I guess let's start with opioids first, and then we'll transition into the coronavirus.
Absolutely. So as we all know, opioids are a significant issue in this country right now. And, from the Action Alliance, it's not something we focus on just because, as I've said earlier, we focus really on the behavioral interventions and the public health interventions. However, we can't ignore the opioid epidemic, and we know that patients are seeking solutions. People have pain. They don't want pain. Mm-hmm. Opioids in general, they have a place, and it's pretty narrow for a select bunch of people in a certain circumstances. They do work well. Opioids notoriously don't work that well for chronic pain conditions. They're not the first line of defense for those types of pain. Chronic pain just doesn't respond very well, not often terribly much better than NSAIDs, certainly over time. You might get an initial relief from an opioid, but it doesn't last. It's that cycle of physiologic dependence and tolerance to the drug that changes over time. So they're not the best choice for OA. So we try to discourage that. And I've seen, actually, in the last few months, I've seen a lot more conversation about non-opioid therapies and making sure that those are available, whether it's from an insurance, Medicare, or Medicaid perspective, or just in the conversation. Let's be looking at other therapies.
And then let's transition to the coronavirus pandemic and how that's impacted what's happening in healthcare in our country, as well as how it's impacting our ability to reach people.
Sure. So it's had a funny impact. I think in many ways, the obvious ones are that it's been challenging for people, obviously, requiring people to stay socially distanced. This puts challenges on seeking healthcare and getting pain medications. Transportation issues become a problem if you can't get close to people. People's jobs have gone away, so healthcare coverage or the ability to pay for care is challenged. Gyms and fitness facilities, senior centers, all of these places where people congregate, churches, that very often provide programs, evidence-based programs, or other services are closed, or people aren't able to go there. So this has really challenged a lot of people's ability to maintain not just their everyday lives, but care for their OA. On sort of a flip side, I would say the good thing that's come out of it is an increase in telehealth. And I think telehealth has really expanded during COVID with coverage for healthcare as if it's a regular visit. So that's definitely been a good thing and has increased access for people to seek certain levels of care. The expansion of drug delivery, pharmacies that deliver medications to people by mail, people being able to get their groceries by mail, all of this it's sort of the pro-con. So I think it's been an interesting challenge. From our perspective, because we so frequently focus on physical activity for people with OA and managing weight, we know that COVID can have a lot of detrimental effects on people's ability to be active, or to, can challenge people's mental, emotional well-being, can even challenge stress eating behaviors and get people to, dispense with their healthy eating behaviors, or maybe they're not able to get to the store to get healthier foods right now. There's just all of these challenges that come with it. So we've tried to respond in a couple of ways. We have curated, along with the Osteoarthritis Research Society International I mentioned earlier, the Osteoarthritis Foundation International based out of Spain, Joint Action down in Australia, and us. We've kind of come together to curate a collection of resources that we've all shared on our respective websites that address physical activity, emotional well-being, pain management even, and the third, apologies, I'm not remembering the third one, emotional well-being, I said, healthy eating behaviors. So trying to bring those resources to people. One step further, we have through the Action Alliance, we have long been proponents of one specific evidence-based program called Walk with Ease. It's actually an Arthritis Foundation program. Traditionally, it's delivered in a group setting with an instructor and as a self-directed format. The group instructor settings aren't happening right now. Very often, community-based organizations deliver those programs, whether it's Parks and Rec or senior centers or area agencies on aging. They are not able to do that right now with COVID. Really important during this time frame. So that's one thing that we've promoted is we have a patient portal that people can come and sign up for the program for free, get a very extensive guidebook to help them through this 6-week walking program. So people can walk outside, be socially distanced and safe, and they're learning at the same time to walk safely and comfortably with arthritis. We also recognize that there are a lot of people that can't walk safely outside. Perhaps they don't live in a community that has sidewalks or where their personal safety is even there. So we're mindful of that, and we're right now taking apart parts of the Walk with Ease program to try to pull out those things that folks can do on their own at home, inside their home or inside their apartment, stretching, strengthening exercises, balance exercises, education, that sort of thing, to try to keep people moving along while the COVID pandemic is going on.
Excellent. I know it's a great program. It's been used for many years with good outcomes and by lots of different health professionals. And as you mentioned, lots of different community organizations. So hopefully we can bring that back, or maybe find a way to even bring that online with more telehealth so people can stay active and keep moving, because we know that physical activity has a tremendous impact on osteoarthritis. Kirsten, it's been great speaking with you today. You're a wealth of information with regard to osteoarthritis. Tell everyone how they can learn more about the Alliance and learn more about you.
Absolutely. So our website is very simply oaaction.unc.edu. You can go there and find all kinds of resources based on the education that I talked about today. We have policy resources. We have monthly webinars. You can find out all kinds of things about us. All of our resources are free. We are primarily funded by CDC and some other grant funding. So what we want to deliver to people, we want it to be freely accessible and taken up by people. So by all means, come, learn, participate in any way, whether you're an individual with OA or an organization that you want to come join us at our table. We have social media platforms, almost all of them that are popular: Facebook, Twitter, Instagram, the whole 9 yards. You can find all of that, as well as sign up for our newsletters. Shameless plug for everything that we do. You can find it all on our website.
Excellent. It is a wonderful organization. I really recommend everyone check out the Osteoarthritis Action Alliance at UNC Thurston Arthritis Research Center. Fantastic organization. They do have a ton of excellent handouts and pamphlets, whether you're a practitioner or whether you're someone who has chronic pain and osteoarthritis. Make sure you check out oaaction.unc.edu. That's oaaction.unc.edu. Make sure to share this episode with your friends and family on Facebook, LinkedIn, Twitter, wherever people are hanging out talking about chronic pain and how to overcome it naturally. I'm Dr. Joe Tatta. It's been a pleasure. Thank you, Kirsten, and we'll see you next week.
Thank you for listening to the Healing Pain Podcast with Dr. Joe Tatta. To subscribe to the podcast and learn more, visit Integrative Pain Science Institute.com. That's Integrative Pain Science Institute.com. Sign up to receive weekly updates, leave a review on iTunes, and share this episode with your friends.